Hi, everybody. Welcome to another Chats with Chaudhrey. I hope you're safe and well. Today, I'm delighted to be joined by Vivien Santillan, who is the Regional Director of Asia for Novatek International and also the former President of ISPE Philippines chapter between 2017 and 2020, and now currently the VP of ISPE Philippines chapter since this year. So, Vivien, good morning. How are you?
Good morning, Rizwan, but it's a lovely afternoon in my location right now. I'm good.
And where are you calling in from today?
I'm calling from Manila, Philippines, the sunny and bright Manila.
Oh, well, I'm glad it's sunny. It was sunny this morning when I looked out the window, but it's starting to get a bit overcast here in Surrey in the UK, but hopefully it'll brighten up as the day goes on. Well, it's lovely to see you. Today we're going to be talking about digital transformation and the opportunities and challenges in Asia. But before we start talking about that, would you mind giving viewers a quick overview of your own role and your background, and a little bit about Novatek International as well?
Thank you, Rizwan. Well, my background really is into information technology. I have been in the IT sector for more than 24 years. And out of that 24 years, 14 years is in the pharmaceutical and biopharmaceutical industry through Novatek International. Well, you have also interviewed my colleague, Mark Vorderman from Europe, and we both work with Novatek. And Novatek is headquartered in Montreal, Canada, and we provide regulatory software solutions for the pharmaceutical and biopharmaceutical industry. So my role in Novatek, as you mentioned, I am the regional director for Asia, and I am responsible for the business development, technical sales, support in the Southeast Asia region, including Japan. And part of this role is to develop and provide support to our business partners and distributors in the region. So in addition also to my role as a regional director, I am also a product specialist for Novatek, and of which I provide technical assistance by conducting process mapping, validation, conduct trainings, not just for the product suite of solution of Novatek, but also on the trends, technologies in the pharmaceutical industry, especially on the topic of computer system validation and data integrity. So I hope I have given you a brief overview of myself.
Yeah, fantastic. So let's talk also, as I mentioned in the intro, you're also very active with ISP. So tell us a bit more about your engagement with ISP.
I have been a member of ISPE since 2012, if I'm not mistaken, or 2011. And as you mentioned, I have served the Philippines affiliate as president from 2017 to 2020. So that's 4 years, and currently VP of the affiliate. I also had the privilege and opportunity to serve as the chair of ISPE Asia Pacific Council, or what we call as the APAC Council, from 2019 to 2020. And since 2020 up to present, I have also been serving as a member of the International Steering Committee of the ISPE Women in Pharma. And again, in addition, as we speak now, we are initiating an Asia Pacific Committee of the ISPE Drug Shortage Team, which is an extension of the core group in the region. So basically, that is what's keeping me busy with regards to the ISPE activities.
Right. Well, we'll touch on all those topics actually as we go along. So let's talk about your activity with ISP Women in Pharma, because I know you're very active in that. How is, I mean, people might have perceptions about Asia and the role of women in work in general in Asia as well. And I know Asia is very different because they're all very different cultures and so on. So how are women involved in the pharma and biopharma industry within Asia?
In Asia, there is mostly women are involved in the pharmaceutical industry because by profession these are pharmacists and chemists. And even in the ISPE leadership, in most of the affiliates, these are headed by women. But again, I think there is, it still lacks diversity with respect to women being involved in the pharmaceutical industry, particularly in the executive level,
Right.
because mostly women are in the quality operations role. And this is where ISPE, Women in Pharma, comes in, where we can provide that diversity for both men and women in the industry to provide that forum of connecting and collaborating on not only on the technical issues, but also on the non-technical aspects like skills development for their career improvement. So this might have a different or similarities in terms of women's involvement in Europe and in North America.
Right. Okay. And I mean, do you think there's anything in particular related to the Asia region which prevents that diversity for women within pharma?
As mentioned, mostly women are engaged in the industry, but again, it lacks in terms of the executive level. But particular, it's mostly on the profession because I think when you are engaged in the pharmaceutical industry, you need to have that attention to detail, which is a trait mostly by women, and that makes it a little bit different. And I know for a fact that in other countries in Asia, like Japan or in India, diversity is not really that in terms of women's role in the industry.
Right. Okay. From your different engagements in the region, what are your observations of Asia in terms of its regulatory landscape?
As you mentioned earlier, there's a lot of diversity in the Asia Pacific region, and this diversity can be attributed because of demographics. So, from the developed countries such as Japan, South Korea, Taiwan, Singapore, and even Australia. And also, there are emerging economy countries such as Thailand, Indonesia, Malaysia, Vietnam, including Philippines. And of course, China and Japan, we can still consider them as emerging economy countries. Um, but we have to realize that Asia Pacific, especially the pharmaceutical market, is the second largest in the world after North America. And it might have a growth, or it will increase its potential and even surpassing that of Europe, which is currently in third place. And in terms of the regulatory aspect, the regulatory landscape in Asia, more specifically in Southeast Asia, um, most of the companies, most of the countries adapt and implement the Pharmaceutical Inspection Cooperation Scheme, or the PICS guide. And in the ASEAN, we call it the ASEAN, which is the Association of Southeast Asian Nations. This is a political and economic union of 10 member states in the Southeast Asia to promote that intergovernmental and inter-country cooperation to accelerate the economic and social and cultural development of these countries. So in layman's terms, it is quite similar to the EU, except for the single currency use. So these 10 Asian countries are Singapore, Malaysia, Indonesia, Thailand, Philippines, Vietnam, Cambodia, Laos, Myanmar, and Brunei Darussalam. And
very well remembered, by the way, Vivian. I was counting as you're going along.
Yeah, because it's 10 member states, so you have to count, and we don't want to miss one country. And as part of this harmonization, they created a mutual recognition agreement, or an MRA, and agreed to adapt the PICS GMP as the basis of this MRA for regulatory standard. So that's what makes it a little bit unique.
Right. And what about the differences, though, between local and multinational corporations?
in Asia, most of the pharmaceutical manufacturers or pharmaceutical manufacturing companies are local companies.
Right.
Though, of course, there are also the presence of the multinationals like the Pfizers, the GSKs of the world. But mostly these are local companies that are thriving. And these companies are generic. They produce generic products, generics medicines. And these are family-owned corporations. Um, it is culturally diverse when you go from one country to another. In terms of conducting business, they have their own customs and traditions in terms of doing business. And I think this is brought about by several factors like language, religion, and as mentioned by customs and traditions. Another thing that makes it a little bit different or unique is the decision-making process. There's also a difference on that between a local company and a multinational company. And as mentioned, for local companies, these are mostly family-owned corporations, and decisions are created, I mean, they decide mainly on the executive level. And unlike in the multinational corporations where the end users are also the decision makers. And that's where innovation becomes a challenge. So, how they approach innovation for multinationals, it is more open. For local companies, there's a lot of apprehension, and that's one of the challenges now in Asia with respect to the local companies.
I mean, do you think? I mean, because normally, I mean, people would say, it might have changed because of the pandemic, but pharma historically is very conservative anyway. So, do you think that companies based in Asia are even more conservative than pharma is perceived anyway, or less so? And also, you mentioned because they're family companies, they're a bit more apprehensive. Is that more to do with size and scale? Because obviously, from my own personal experience, sometimes with family companies, because they are family companies, they can make decisions quite quickly as well, sometimes compared to a multinational. So, what would you say to that?
Well, first is, as you mentioned, it's in terms of the scale of the business. And that is very true. It can work both ways. Decision can be easily agreed upon, but it can also be a game changer altogether. So I think there is always the pros and cons on both side of the whether it's a local or multinational companies. And as you mentioned, it's family owned, and most of the decisions are localized, and they are um, they have a specific way of doing their business. So that is also another challenge, or it can also be an opportunity because, as you know, especially in marketing, it's who you know and who knows you in return. So there's a lot of pros and cons in both ends of the situation.
Right. Now let's talk about the pandemic. Obviously, in the West, for want of a better term, in sort of certainly in Europe, North America restrictions are starting to ease a bit, and people are starting to travel and so on. And numbers, thankfully, are falling at the moment. What is the current situation within the Asia region, and also how has it impacted the industry?
Well, currently, there is we are also beginning to ease up in terms of movement, unlike in the past year where there are lockdowns and border controls, so there is limitation on movement and logistics. And again, of course, as you may know, everybody experienced that form of shortage, whatever kind of shortage, whether food or drugs or medicines and essential goods. But currently, because we are slowly opening up, quarantine, we don't have quarantine regulations or restrictions now. And in terms of travel, each country has their own regulations on whether they will be accepting tourists or people for business. So it's a case by case basis.
Sure.
And in terms of the on how we are adapting, or what was the impact, or what is the impact of this pandemic in the region, specifically with the industry, we continue to learn. And again, as mentioned, we keep on adapting. And there's a lot of discussion on the improvement of your business continuity plan, how to stabilize the supply. And from time to time, we still experience certain shortages. But because of the learnings from this pandemic, we become proactive and learn to be not reactive. But of course, it's a learning. It's a long way to go on how to have that sustainability. But I think what is more important is our way forward on the learnings with this pandemic. There is already that realization to pursue self-sufficiency. When we talk about self-sufficiency in the region, especially in the Southeast region, this is a self-sufficiency program, especially in vaccines. There are countries in Southeast Asia like Malaysia and Philippines that does not have the capacity or the facility to produce vaccines. And currently, this is something that the government of each of these countries are doing to have that self-sufficiency program. Another thing is through the assistance of like the World Health Organization or the WHO, there are technology transfer programs, especially on mRNA, which is the in thing now in terms of vaccines, for countries who has the capacity or the capability who has the facility for vaccine production. These are Indonesia, Thailand, and Vietnam. And there's a lot of, in terms of trends that is brought about by this pandemic, like in the Philippines, we are putting in place policies and adoption of regulations with respect to clinical trials. Right. Because we know that we need to be open in terms of this clinical trials for the development of medicines, not only vaccines.
Fantastic. Right. So let's look at the opportunities and challenges because of the pandemic. I mean, what do you think were the significant changes that companies in the industry have adopted? And did it require a change in overall business policy as well as process?
Well, as mentioned earlier, Asia Pacific is growing. And again, this is attributed to several factors. Asia Pacific is a big continent. The size of the population, especially the older population, the health expenditures, and and because of the pandemic as well, there are constant change in the regulatory landscape and even the regulatory standards. And as mentioned, this is brought about by the impact of the pandemic. So most of the pharmaceutical companies must improve productivity while ensuring compliance and quality. And the thing is, under more and more regulations, right? And this must be accomplished now while working on a limited budget or a constraint on their budget. With these indicators, the size of the population, the ever-changing regulatory standards or the changes in the regulatory standards, companies are beginning to realize that they must accomplish this or to be at par with the other countries and to improve on their processes. And they realize now that they have a need to adapt to new technologies, such as innovation and, of course, digital transformation to become current in the industry trends and to ensure that their programs and all of their initiatives become sustainable. And again, of course, this is now where the opportunities comes in for the digitalization and the digital transformation of their business processes.
Right. And having been able to identify and determine those gaps and challenges being experienced by the pharma companies in Asia with respect to, like you mentioned, the digital transformation, what do you think the appropriate solutions will be to help them in compliance?
Besides the improvement of their process through digital transformation, another aspect that they need to look into is people. So these are the workforce, making sure that our workforce are equipped in these improvements and changes. And for the pharmaceutical industry, of course, as you may know, Novatek has been in the forefront in providing and assisting the industry on how they can cope up with these changes. And of course, we are more than willing to assist them in providing best practices, improvement in their regulatory system, programs that can benefit their organization, as well as the knowledge management. And that's where we come in most, the knowledge management. When you talk about digital transformation, it's not just the transition of the manual to digital aspect, but more on analyzing your data. Your data are important, which becomes your information. And this information needs to be transformed into knowledge, where you will have your insights for your decision making.
Sure.
And that's the strength of Novatek. We have all the data analytics within our application that provides all these aspects of improvement in terms of their business processes.
Brilliant. Well, that's great to know, and thank you for sharing all that information with me this morning, or this afternoon in your case. So if people would like to know more about the topics we've talked about, both relating to digital transformation, like you just said at the end, and also about ISP, where can they get more information?
Well, as I always say, because I do a lot of webinars in the region, let us continue to be challenged and excited and be inspired in the manufacture of better medicines and patient safety through the improvement of our processes. And of course, digitalization or the digital transformation of their business processes can definitely assist the organization. And ISPE Philippines, we do have a lineup of activities. This March, we will be having a webinar on good distribution and storage practices. Especially, Philippines is a humid and hot country, and this COVID vaccines needs to be kept in a specific temperature. So how do we maintain this drugs, these vaccines in such temperature? So GDSP, or good distribution and storage practices, is a relevant issue or concern in the country right now. Novatek will also be having a lot of events for the year, and they can always check out our website. And they can also follow us in our LinkedIn page and Facebook page. So watch out for all of these events and webinars.
Fantastic, Vivian. Well, look, I appreciate taking time out to talk to me today. It's been lovely to see you, and hopefully we can see each other in person, maybe at an ISP event or another event. I don't actually tend to travel to Asia Pacific, unfortunately, because I've got enough going on in Europe and North America, but you never know. So it's lovely to see you. And there you go, viewers. If you'd like to know more, I hope you found that really interesting, first of all, because it is always interesting to find out what's happening in other parts of the region, and particularly if you work extensively in Europe and North America. It's good to get that point of view and understand what's happening in other parts of the world as well. So I hope you found that useful. If you'd like to know more about what Novatek are doing, you can check out the links above the video. And if you'd like to know what ISP are doing, then again, you can check out the links above the video, because it'll all be there for you to get more information. I know Vivian is very, very active on LinkedIn as well, so you can send her messages on LinkedIn. I'm sure she'll be happy to answer them, or put your comments and questions below the video and she'll be happy to answer them. So all that's time to say is, Vivien, enjoy the rest of the week. I hope you have a fantastic week this week and a fantastic 2022. And it's lovely to see you, and hopefully we can catch up in person in the not too distant future.
Definitely. Looking forward to meeting you in person, hopefully soon.
Yeah, let's hope so. And there you go, viewers. Thank you for watching. And as always, stay well and stay safe. Bye-bye.